I think it's hot. Good morning and welcome. As we continue to navigate through COVID-19, it's imperative to keep health and safety as a top priority. And I think our teachers and administrators out in the schools and all our central office people have done a great job of that. I'm proud to announce that Montgomery Public Schools has partnered with UAB and Bloom to administer COVID-19 weekly testing in our elementary schools. Currently, we are testing in 21 of our schools. Weekly testing is voluntary and is available to staff and students. We have intentions to expand this partnership to all 52 of our schools. So we want to encourage our parents to fill out the form because we know we have to have permission to do this with our young ones, but it is available at your school. So please look into that, parents, so that you can take advantage of this testing. Now, we want to remind everyone that health and safety continues to be our most important concern. And so sometimes we do things that someone may question, but it is all because of health and safety. So we are continuing at this point to wear our mask. We're going to look at our COVID-19 protocols early next semester. We're going to review them. Please note our top priority, however, again, is health and safety. We have about 27,000 kids that we have to look out for all the time. We want to keep our students and staff healthy in our school buildings, and so we're continuing to clean those on a routine basis. And again, thank you, Montgomery, for your continuous support.
Good morning. My name is Martha Wingate. I am the principal investigator on the COVID-19 testing in Alabama's K through 12 schools. I'm a faculty member at the University of Alabama University of Alabama at Birmingham, UAB School of Public Health, and I'm very excited and happy to be partnering, that we are able to partner with Montgomery Public Schools. So I want to give you a little bit of background on our program. We at the School of Public Health are currently collaborating with the Alabama Department of Public Health and the Alabama State Department of Education to offer free and voluntary asymptomatic COVID testing to students. This is the nose tickle. I've had this question before. This is the swab in the nose, the easy, we're just going to tickle students' nose, not the diagnostic testing. And this program is fully funded by the U.S. Department of Health and Human Services and the Centers for Disease Control. And our program team within the UAB School of Public Health works separately with each school to figure out what works best with them, to create this testing plan that works well for them. Then we have a team from Bloom Health Partners come in and continue to work with the school as well, and then provide those results as quickly as possible within 24 hours. So why is testing important? Dr. Moore talked a lot about the idea of health and safety. Our goal is to help the schools and help teachers, faculty, staff, et cetera, which are all a part of this program as well, to stay in the classroom. That is key, to keep these kiddos that I saw some of them outside the door, to keep them in school and in the classroom learning. So really what this routine screening of people without symptoms helps to reduce the silent spread of the virus. So we know that there's a lot around asymptomatic spread of coronavirus. And so this idea of protecting our community, so protecting grandparents or aunts and uncles that are outside of the school, how important and key that is. So again, really making sure that we want to maintain that safe in-person learning environment for Alabama's students and for Montgomery students. So testing takes less than a minute. It creates, like I said, that sensation of a little tickle in the nose, and it's free and voluntary, and you can opt in or out at any time for your children, and as well as faculty and staff. And so, as Dr. Moore said, we are currently testing in 21 Montgomery elementary schools, and that's about 1,700 participants total between students and staff. To register for this program, there's going to be more information available on that, I know, but we want you to contact the school's administrator and the school nurse, and they will be able to provide either a paper consent form or an electronic link to register for your school's program. So these are two methods for registering. So we're going to get you one way or the other. You'll have access to it, certainly. And we really are so excited and honored to be working with the school system, with Dr. Moore. We've been in conversations for quite some time, and we are just thrilled to see this launching and just look forward to continuing to work with you all and to make sure that this is a positive experience for the children, for the students, for the staff, and just to make sure that everybody stays safe. Thank you.
Well, good morning. I'm Andrew Morton, CEO of Bloom Health Partners. We're the organization tasked with making sure that that little tickle is as unintrusive as possible for our young ones here in the state. Before we get into Bloom Health and our background, I just want to extend a special thank you to Dr. Moore and Dr. Wingate for having us here today. When we answered the call and were asked to do testing here in the state, we recognized there's a heavy responsibility that comes with a healthcare company. And we did take this extremely seriously to make sure that as a voluntary program, we bring the lightest touch as possible to the schools. Our locally staffed offices here in Montgomery are now serving a large part of the state, but specifically here in the Montgomery area, we have, of the schools we're testing, our people are out every day, very carefully reaching the students. We like to put little stickers on them and do those kinds of things, because the idea is this shouldn't be a heavy thing for the children that have it volunteered. Our goal here is to make sure that families feel safe with their young ones. Within the platform that Bloom Health Partners delivers, our company is offering the ability for 24-hour turnaround for test results. The whole idea behind this is that families know right away what's happened within the testing, and the schools feel safe. But as an organization, our responsibility, and as an occupational health company, is to make sure that the states and the families feel comfortable with what we're doing. So as an organization, we're committed to this promise and are honored that we have the opportunity to do this. Thank you.
Good morning, I'm Dorothy Rogers. I'm the lead nurse for Montgomery Public Schools. I just want to encourage all the parents, and first of all, I want to thank UAB and Bloom for this opportunity. This is just one step in the mitigation process of getting rid of this disease. I want to encourage all the parents to participate. It's not a horrible thing to do. It's not the brain swab that everybody complains about. And I just wanted to encourage everybody, and all of our nurses are working with Bloom and UAB to try to help this go as smoothly as possible. Thank you so much.
So at this time, I'll take any questions that you may have, and if I need to call on someone to assist me, I will certainly do that.
Dr. Moore, just talk a little bit about what has the response been like from the parents as far as the testing that you all are trying to do, because it seems as though you're trying to do everything you can to make sure these kids are safe.
Right. So we're at about, I think someone said about 1,700. We would love to have more, because this is a wonderful opportunity. It does not cost anything. It's non-invasive, and it gives us information that would tell us something early on rather than waiting until someone comes down perhaps with COVID-19. We could actually perhaps know that through a test that there is something going on, and that parent can be notified, and then something can be done sooner rather than later. So we're encouraging everybody to come forward and take advantage of this opportunity.
Where we stand right now as far as COVID is concerned in the public school system, are we in a better place than we were a year ago, or where are we right
Oh, most certainly. We're in a much better place. We're not doing a lot of quarantining. We're still checking on a routine basis. Nurse Rogers and her nurses are checking. We have seating charts. We have a lot of protocols in place that we did not know we should have in place early on, but we've been practicing and implementing those protocols, and so we're in a much better place. We're in school. We have not really had to send anyone home in recent months, so we're doing much better.
To that parent who still may be on the fence and concerned, what is it that you can say if you could talk to them right now that would ease that concern?
Well, I guess I would say as a former teacher and perhaps as a mother, I certainly would take advantage of this testing. Like I said, it's non-invasive. It's not going to hurt anything. It's not going to hurt anybody. We want their permission to do it, especially with the young ones, because as a school system, we have to have permission to do certain things. But as a parent, I would certainly be an advocate to other parents to take advantage of the possibility of being tested early on, and as I said before, sooner rather than later.
Were there any obstacles that you had to overcome for this partnership to come together?
No, not really. They called up, UAB called and said, we have an opportunity for you, and I always love opportunities, especially if it's going to benefit our students. And so right away I said, yes, by all means. And then we talked, and we did a video and to promote it, and all that's out there right now floating around, even with other school systems. But to be one of the first ones asked as a school system to participate, to me is a great thing, and I'm always trying to advocate for our students and do what's best for them. So we didn't really have any obstacles. We had to work out the protocols of getting parental permission and things like that, notifying our principals of what was coming down the pike and making sure everyone had as much information as they needed. And even now, ongoing, if they need information, we'll get that for them. Okay. Thank you very much.